Hello guys, Terdissima Franca here and welcome to my lecture video for the Psychology Board Exam. For this video, I'm going to give review questions for the subject Abnormal Psychology. Before we begin, please don't forget to hit the subscribe button. Question number 1. This term refers to recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted. A. Obsessions, B. Compulsions, C. Distress, or D. Disability. Time is up. The correct answer is letter A, obsessions. Question number 2. This term refers to repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. A. Obsessions, B. Compulsions, C. Distress, or D. Disability. Time is up. The correct answer is letter B, compulsions. If you have noticed, question number 1 was defining the term obsession, while this question defines the term compulsions. Obsessions and compulsions are two major signs of a person having OCD or obsessive compulsive disorder. OCD is characterized by the presence of obsessions and/or compulsions. Obsessions are recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted, whereas compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. Question number 3. This disorder is characterized by persistent difficulty discarding or parting with possessions, regardless of their actual value, as a result of a strong perceived need to save the items and to distress associated with discarding them. A. Hoarding. B. Trichotillomania. C. Substance or medication-induced obsessive-compulsive and related disorder. Or D. Obsessive-compulsive disorder. Time is up. The correct answer is letter A, hoarding. For example, symptoms of hoarding disorder result in the accumulation of a large number of possessions that congest and clutter active living areas to the extent that their intended use is substantially compromised. The excessive acquisition form of hoarding disorder, which characterizes most but not all individuals with hoarding disorder, consists of excessive collecting, buying, or stealing of items that are not needed or for which there is no available space. For me to be able to understand what hoarding disorder is, I just watch videos. Okay, when I try to define hoarding disorder, I don't remember words, but actually I just recall the videos I've watched. So you can also try that. There are a lot of videos about people having hoarding disorders, and then that's it. It'll be easy to remember the definition. Question number 4. This disorder is characterized by recurrent pulling out of one's hair, resulting in hair loss, and repeated attempts to decrease or stop hair pulling. A. Hoarding. B. Trichotillomania. C. Exfoliation. Or D. Obsessive compulsive disorder. Time is up. The correct answer is letter B, trichotillomania, also called as hair pulling disorder. Question number 5. Joseph, 25 years old, single, who lived with his family, was admitted to OPD or Outpatient Department of Psychiatry. He began skin picking sporadically and presented with complaints of excessive skin scratching and skin picking of the fingers, forearms, and upper back for the last 3 years. Skin picking has been his daily routine, which is associated with emotional stress, followed by a relief after picking. A. Hoarding. B. Trichotillomania. C. Excoriation. Or D. Obsessive-compulsive disorder. Time is up. The correct answer is letter C. Excoriation. Excoriation or skin picking is a disorder characterized by recurrent picking of one's skin, resulting in skin lesions and repeated attempts to decrease or stop skin picking. The body-focused repetitive behaviors that characterize this disorder is not triggered by obsessions or preoccupations. However, they may be preceded or accompanied by various emotional states, such as feelings of anxiety or boredom. So remember that. Question number 6. The following are true about OCD or obsessive compulsive disorder, except A. Many individuals with OCD have dysfunctional beliefs. B. The obsessions and compulsions are time-consuming. C. They see the disorder as a sign of perfectionism. Or D. The individual attempts to ignore or suppress such thoughts, urges, or images, or to neutralize them with some other thought or action. Time is up. The correct answer is letter C. They see the disorder as a sign of perfectionism. Actually, C is a perfect example for the OCPD or Obsessive Compulsive Personality Disorder. OCD is defined by the presence of true obsessions and or compulsions. Conversely, with OCPD, the behaviors are not directed by thoughts you are unable to control or irrational behaviors you repeat over and over again, often with no apparent aim. As the name implies, it has something to do with their personality. So people with OCPD see their behavior as a sign of perfectionism rather than people with OCD. Okay? Question number 7. The following are differential diagnoses for OCD identified by DSM-5, except A. Major depressive disorder. B. Eating disorders. C. Dissociative disorder. Or D. Anxiety disorder. Time is up. The correct answer is letter C. Dissociative disorder. For major depressive disorder, OCD can be distinguished from the rumination of major depressive disorder, in which thoughts are usually mood congruent and not necessarily experienced as intrusive or distressing. Moreover, ruminations are not linked to compulsions, as is typical in OCD. For eating disorders, OCD can be distinguished from anorexia nervosa in that in OCD, the obsessions and compulsions are not limited to concerns about weight and food. For anxiety disorders, recurrent thoughts, avoidant behaviors, and repetitive requests for reassurance can also occur in anxiety disorders. So the best answer for this question is letter C. Question number 8. J, 25 years old, middle class, and living with parents. One day, his friends commented about his face that he was ugly, and they started teasing him. After that, Jay obsessively think about his face and body. He began looking at himself in the mirror frequently. His interaction pattern started to decrease. He spent more time alone. His sleep decreased and he was covering his face with clothes more often. A. Body dysmorphic disorder. B. Obsessive compulsive disorder. C. Excoriation. Or D. Trichotillomania. Time is up. The correct answer is letter A. Body dysmorphic disorder or body dysmorphia. Individuals with body dysmorphic disorder are preoccupied with one or more perceived defects or flaws in their physical appearance, which they believe look ugly, unattractive, abnormal, or deformed. The perceived flaws are not observable or appear only slightly to other individuals. Concerns range from looking unattractive or not right to looking hideous or like a monster. Preoccupations can focus on one or many body areas, most commonly the skin, hair, or nose. Question number 9. A 57-year-old man with raw, chapped hands is referred to a psychiatrist by his primary care doctor. The man reports that he washes his hands repeatedly, spending up to 4 hours a day using abrasive cleansers and scalding hot water. Although he admits that his hands are uncomfortable, he is entirely convinced that unless he washes in this manner, he will become gravely ill. A medical workup is unrevealing, and the man takes no medications. What is the most appropriate diagnosis? A. Obsessive-compulsive disorder with absent insight. B. Obsessive-compulsive personality disorder. C. Generalized anxiety disorder. Or D. Delusional disorder, somatic type. Time is up. The correct answer is letter A. Obsessive-compulsive disorder with absent insight. Absent insight is the specifier. So DSM-5 has added an insight specifier to the diagnosis of obsessive-compulsive disorder to acknowledge that persons with a disorder can range from having good insight into the irrationality of their behaviors to having no insight. Okay? And question number 10. Although gambling can seem compulsive, gambling disorder is not considered a type of obsessive-compulsive disorder for which of the following reasons? A. In gambling disorder, individuals have control over their repetitive behaviors. B. A person with gambling disorder derives direct pleasure from the behavior. C. Individuals with gambling disorder have poorer insight into their irrational behavior. Or D. Gambling disorder is better conceived of as a personality trait. Time is up. The correct answer is letter B. A person with gambling disorder derives direct pleasure from the behavior. Although a number of behaviors such as gambling or sexual behavior can seem compulsive, gambling disorder and sexual paraphilias differ from OCD in that the compulsive behaviors associated with OCD are meant to decrease anxiety. So the keyword is anxiety, decrease anxiety. Whereas in the other disorders, they are a source of direct pleasure, just like with gambling disorder. Individuals with gambling disorder seek treatment mainly out of concern for the deleterious consequences of their behavior. In both gambling disorder and OCD, the level of insight into the behavior can vary. But like individuals with OCD, those with gambling disorder cannot control their gambling. So that's it. We're done. What's your score? Hello guys. Thank you for watching my video. If you like what I'm doing and if you want more of it, please show your support by subscribing to my YouTube channel and don't forget to hit the notification button so that you'll be updated for new uploaded videos. Thank you.